Hi, and welcome to Healthy Living. I'm Debbie Lyons. I'm here today with Dr. Jeff Reuben. Thank you for joining us. It was fun to see you again. I've talked to you before, and it's a pleasure to see how the Spine Center has really evolved. You've got a well-oiled machine here, and we're really pleased to be able to talk with you. Wanted to talk today, if we can, day at a glance, kind of talk at a glance, do kind of an overall broad spectrum chat for a minute about what you and Dr. Boatwright do, and then really what's going on here at the Spine Center.
Sure.
So again, thanks for everything.
My pleasure. Thanks for having us. So Dr. Boatwright and myself specialize in adult degenerative spinal disorders.
Okay, adult degenerative spinal disorders. Explain what that means to a layperson or a potential patient.
Sure. So usually 18 years and older.
Okay.
Okay. Anything from disc herniations, which I think people know what they are, spinal stenosis, which happens to be narrowing of the room for the nerves,
Okay.
or pinched nerves.
Okay.
We actually will see traumas.
Okay.
Okay, motor vehicle accidents, traumas, falls. We see lots of falls from heights, ladders around here. So anything that has to do with degeneration of the spine that would cause some type of injury or disability or pain.
Can I ask you a question, just a general overview about the spine? What is that? We all think we know what that is and looks like. From where to where in my body am I talking about?
Sure. So we have the head.
Okay.
So there's the head, and then the spine starts at C1, cervical, meaning neck.
Got it?
Thoracic.
Okay.
Lumbar.
All right.
Low back, and then sacrum or pelvis. So technically the spine is C1 all the way through lumbar 5.
If it's not a trauma, when do you typically see patients? Am I in chronic pain? Am I in acute pain? How do I know that I actually need to see a spine specialist? I've always wondered that.
So it's a great question. So we see all spectrums. We
Okay.
see someone who was absolutely fine until an hour ago, and they did something and they're hurting. Anything that possibly can be from the spine, we want to see. We want to see early. We do non-operative care.
Okay.
So we will do physical therapy, we will do medicines, we will do bracing, we will do injections. So we do lots of non-operative care. And then obviously we like to do operative care when necessary. So we like to basically shepherd the entire care of the spine.
Can I talk about some of the services that you offer here? Because I know that you just recently won an award.
Correct. We got the gold seal of Spine Center Excellence from Joint Commission.
That's a big deal.
Big deal.
What are some of the things that you do here? Robotics? And how do I know if I'm a candidate?
Correct.
Okay.
So we have everything here. We have minimally invasive surgery to maximally invasive surgery. So Dr. Boatwright and myself are able to do the entire spectrum of spinal surgery.
I have to interrupt you and say that sometimes we think that to get the best care we have to go across the bridge.
Correct.
That is so far from the truth here. And I remember first interviewing you, listening to credentialing and experience and things like that. It's pretty amazing what we can do here.
So Dr. Boatwright went to Harvard.
Yep.
He's a Rhodes Scholar, and I tease him. I went to Hopkins, so we always tease each other.
Little competition.
Exactly. So I think that Harvard trained and Hopkins trained, I think you're getting very well trained individuals, and we were very fortunate. We had wonderful mentors, and we think that we are able to, what we do here, we specialize in, and we think we do it at the top level.
Why robotics? Why is that so important from a treatment point of view and a patient point of view?
Sure. So in order for us to do surgeries safely and effectively, we need to be able to know where we are in the spine while we're doing the surgery. So we used to take x-rays, conventional x-rays. Okay. Then there's something called fluoroscopy, which is the next step. Then there's intraoperative CT scanning, which gave us the three-dimensional ability.
Okay, that's cool.
Okay. What robotics does is it's the next level. So with robotics, we actually have integrated computer integration. So we have computer-assisted spine surgery.
Oh, wow.
Okay, so we link a computer to a robot.
Okay.
We can plan the trajectory of all of our instrumentation.
Okay.
So we put in screws, we put in rods, we put in plates, we put in things to help stabilize the spine.
So you're actually doing all the manipulations. It is not as though a robot is there, no.
Correct. There is so what the robot does, the robot will allow us for intraoperative three-dimensional navigation.
Okay.
It also allows for robotic trajectory control.
Okay.
So it makes
Precision.
sure, exactly. So it makes sure that our computer plan, or a preoperative computer plan, is carried out intraoperatively in millimeters.
Oh, wow.
Yeah.
And that's pretty important when dealing with the back.
Sure, because you don't want to be off by a few millimeters.
From a recovery standpoint from a patient, does it improve the recovery because it's less invasive, or how does all that work?
Sure. So one of my sayings is you have to do the right surgery first. I think that's very important. And you have to get the job done in the most limited way. So we want to do minimally invasive surgery if you can achieve your goals. The robot allows us to do that. So whenever you can do it in a less invasive way, it does speed recovery.
Well, and which makes a lot of sense. How do I know if I'm a candidate for that? My assumption is that we as patient and physician sort of partner in making some of these decisions. Do you find that many of your patients are more informed than they were 10 years ago, or just because?
I think there's no question the internet has helped tremendously. I think there's no question the internet
has hurt. Yes, exactly.
Has some information that may not be correct. So what I try to tell my patients, you asked a great question. When should you see a spine surgeon?
Yes.
So we love to see people early. We want to see them at the beginning. But spine problems can cause unusual symptoms. It can cause balance problems.
Oh, that's
it can cause hand dysfunction. So if you have spinal cord compression, it's called myelopathy or spinal cord dysfunction, and you get weird symptoms. You get hand dysfunction, your problems buttoning buttons, problems tying your shoes. You actually get balance problems.
Interesting.
And we want to see those people right away. Also, there's something called claudication or neurogenic claudication.
Okay, claudication, neurogenic claudication.
Okay, so claudication means leg pain with standing or walking. And a lot of people think that that is vascular, and sometimes it's from blood supply, but the other main reason is spinal stenosis in the lumbar spine.
And we talked about that at the beginning. What exactly, you said it's a compression.
Correct.
What causes that? Is that just I'm 66 years old and so
Sure.
be it?
So spinal stenosis can be caused by disc herniations. It can be caused by arthritis, which causes bony spurs. So bony spurs can press on the nerves as well. And then we all know that we get shorter as we grow, or as we get older.
We try to have good posture.
Exactly. So, but losing disc height also narrows the room for the nerves as well.
It's really interesting, and again, I know we have to go right now, but Dr. Reuben, you are amazing to talk with. I think it would be fascinating to have you back again. There are so many little things that we could talk about that I think would educate the population, and you're very articulate. We thank you for your time.
Thank you.
We thank you for your time here in Healthy Living.